Hello everyone, my name is Sandy Miller and this is my intervention video presentation for Social Work 5013 with Dr. Hillary Cobb. The treatment approach that I would like to discuss in this video is cognitive behavioral therapy. So we'll talk about the client for a minute first. The client is Maria. She is married, she has 3 children, and she has recently suffered a great loss. Her mother died after being diagnosed with cancer, and this loss has really impacted Maria and her ability to function in her day-to-day life. She is having trouble getting out of bed. She's having trouble caring for her children. She feels lots of feelings of guilt and sadness every day. Maria is from South America, so her culture is very much in the mindset of you should just be able to get over that. You should be able to get over that and move on quickly. So this has been a very difficult time for Maria. She also has a child who is struggling in school, which has been a very difficult situation for her as well. Her trouble sleeping, of course, affects everything else that she does. So we're going to be talking more about Maria. I just wanted to take a minute to introduce her. And so cognitive behavioral therapy, Dr. Aaron Beck is considered the father of cognitive behavioral therapy. He created this therapy process back in the 60s, so it's been around for a while. It's kind of, I'm going to say, tried and true a little bit. And so this therapy, the cognitive behavioral therapy, has been proven to be effective in treating many different conditions for people, medical conditions and psychological conditions. Both of those it has been proven to be effective in. One thing about cognitive behavioral therapy that is really interesting is the importance it places on the relationship between the therapist and the client. So the therapist is not really seen as the authority in this relationship. It's a collaborative relationship between the therapist and the client, which is really great. The client is actively involved in setting the agenda for the therapy sessions, actively involved in the treatment process. And this relationship between the therapist and the client has been proven to be very, very important in the progress that the client makes. Okay, so let's talk about what does the research show. There is a lot of research on cognitive behavioral therapy. The American Psychological Association says there are 3 core principles to cognitive behavioral therapy. The first one is that psychological problems are caused in part by faulty ways of thinking. The second one is that psychological problems are caused in part by learned patterns of unhelpful behavior. And the third core principle is that people suffering from these psychological problems can learn new ways to cope, which will therefore relieve some of their symptoms and help them be more effective in their lives. So some examples of disorders that can be treated with cognitive behavioral therapy are anxiety, depression, panic disorders, schizophrenia, and bipolar disorder. And according to an article by Fordham and his associates looking at the effectiveness of cognitive behavioral therapy is where the majority of psychological treatment research is dedicated. Cognitive behavioral therapy has been shown to be effective with men, women, adults, children, people from different cultures. It's all been shown to be effective with all those people. So cognitive behavioral therapy, according to the article I mentioned earlier, the biggest area of uncertainty and research is whether factors like ethnicity, religion, the country you live in, or language could affect the cognitive behavioral therapy process. This has been called the gold standard of therapy. It is an evolving, evidence-based practice with much research support behind it. But even with all this research support and this pretty great track record, there are some people who will still relapse after using cognitive behavioral therapy, and some people just don't respond to cognitive behavioral therapy at all. So let's go back and talk about our client, Maria, for just a moment. Maria is going to be treated with cognitive behavioral therapy in dealing with her grief over the death of her mother. This grief is affecting her everyday life. It affects her ability to care for her children. It's affecting her ability to deal with the problems that her son is having at school. It's even affecting her sleep and her ability to get out of bed in the mornings. So it's very important that we look at this grief. Cognitive behavioral therapy has been proven to be effective in treating bereaved adults. The research supports the use of this process. Cognitive behavioral therapy is one of the most recommended treatments for people who are suffering from chronic insomnia. And in some research by Batterham and his colleagues in 2023, it shows how cognitive behavioral therapy has been shown to be effective in treating insomnia for people who have other co-occurring disorders, mental and physical, as well as being effective in treating people who are suffering from insomnia, but not other mental or physical disorders. For meeting with Maria, ensuring that she is comfortable and has a safe and confidential place to talk, we begin to talk about what all has happened in her life, the death of her mother, how this is affecting her on her day-to-day activities and living with her husband and her children. This has all been extremely difficult for her. So we together decide upon a plan of action, and that plan of action includes homework. In that homework, Maria will journal, and the goal is for her to journal in the evening, every evening, hopefully, and she can rate her sadness for the day on a scale of 1 to 10. And so in rating her sadness on a scale of 1 to 10 will help her reflect on her day, things that may have triggered this sadness, things that she can just take some time to think over. And then also she was asked to remember a happy memory of her life with her mother and to write that in her journal as well. The hope is that ending her day with a happy memory of her and her mother and their life together will help her to work through this grief, will help her to end her day on a positive note, and hopefully that will encourage some good sleep and help with the insomnia. Because without good sleep, it's going to be difficult for her to recover and do better with the other things that she's having to deal with. We are also looking at extra support for Maria. This includes a group grief therapy. Her husband had recommended this. I think it's a great idea. And so she is going to look into that on her own with some recommendations, and also trying to get her more connected in her church with her church family. She doesn't know a lot of the members very well, but they do attend a church. So getting that support would be good for her, support from other women in her church, because she's missing that connection with her mother. And she had stated in earlier sessions that she did not have many other friends besides her mother. Her mother was her very best friend. So that is the plan of action with Maria and how it's worked out so far. Thank you for joining me in this discussion for cognitive behavioral therapy.